You could go ahead and get started.
Hi everyone, my name is Ahmed. I'm a fourth year medical student at Trinity. Thank you so much for joining us tonight. Today I have a presentation about the quadricuspid aortic valve, and I did this presentation when I had my cardiology rotation with Dr. Nisreen Jalal. She supervised this case. So at the beginning for the abstract for my presentation, also the quadricuspid aortic valve, also known QAV, it's the aortic valve that have four leaflets. It's a rare congenital anomaly. We'll see that in a few seconds. Uh, it may cause aortic regurgitation in the fifth or the sixth decade of life. The diagnosis in the past used to be just postpartum when the people die, but in these days, the use of the transesophageal echocardiogram and the MRI, cardiac MRI, allow us for the early detection and diagnosis. Uh, as I said before, most of the cases diagnosed asymptomatic in these days. Uh, and we faced during the rotation a 69 years old white female who found a symptom. She had acquired aortic valve and using the TE. Now, just as an intro, the aortic valve mostly is have three leaflets, like in this graph in B, but there are other anatomical variation, like this one, the unicuspid aortic valve, and then the other one, bicuspid aortic valve, which is more common than the D, and the other one, the four leaflet aortic valve, and bicuspid have many other clinical significant like hypertension and murmur. Due to the use of the TE, there is increase in the awareness, and this will change the types and the management in the future. So just for some numbers about the quadriflex aortic valve, it's usually very rare, about 0.01, the prevalence 0.013. First known cases was in 1862, and it was discovered postpartum. At that time, there is no echo, and there has been only less than 200 documented as a case report, like the one that I am doing right now. But of course, there are more than 200 cases, and most of them asymptomatic. Now, for the case report, can't see this. A 69 years old Caucasian female brought from Marna Robbins Rehab Facility with acute confusional status and constipation of one day duration. She have left upper quadrant pain, started 2 days prior her coming to the emergency room. Her past medical history is significant for anxiety, depression, and chronic narcotic use for pain syndrome, hypertension, and cerebrovascular accident, and GI bleeding. Her vital sign as her initial as a, when she presented was 97.9 Fahrenheit, 99 pulse, respiration was 16, blood pressure 103 over 54, and oxygen saturation 99. When they did the lab finding for her, they found she had leukocytosis 14.9. So at that time, they suspected for UTI and they treat her accordingly. After a few days at the hospital, on day 6, patient decreased responsiveness and developed tachycardia, low blood pressure. Also, she noted that she have anisarca, which is a generalized swelling and edema. Patient giving antibiotics, furosemide, naloxone at that time, and her mental status improved. As part of the evaluation, she had an echo and chest CT scan. The CT scan shows pneumonia, and they treated her by the primary care team at that time. And the echo findings suggest aortic valve sclerosis with some kind of density, and they couldn't rule out vegetation, so they put a consultation for cardiology in her chart. So when we saw her with Dr. Jalad at the bedside, she recommended doing the transesophageal echo for her, and she agreed in the procedure. And the next day morning, we did the transesophageal echo. We found she have a normal ejection fraction, about 55%, but we discovered that she have the quadriflex aortic valve, and she couldn't exclude the vegetation that she was worried about. Now, these are the pictures for the uh, for her aortic valve that we saw, and this, I think, better picture than the previous one. And the patient treated accordingly. So the discussion for the QAV, it's a rare congenital anomaly, usually diagnosed in the fifth or the sixth decade. Before this, it's asymptomatic, but it may lead to aortic regurgitation. Uh, at the beginning, there was just quadricuspid aortic valve, but I was reading yesterday, there are right now several types and variation also, the kind of classification for the QIV. And one of the hypotheses about why it's happened, it was behind the abnormal septation in the embryology during formation of the truncus aortosis. Usually it appear isolated as a congenital anomaly, but it can be associated with other malformation with the coronary artery anomalies. And the best mode to find it is using the transesophageal echo. So in conclusion, the quadriflex aortic valve, it's a rare anomaly. I saw it, and Dr. Jalad recommended to do this case presentation as it's not something to see every day. Previously, she told me it's usually asymptomatic and has not have clinical significance, but during the recent change, right now they recommend to early detection for it, and they require surgery in order to avoid the aortic regurgitation that happen in the future. Uh, After the patient diagnose, sometimes they recommend for the aortic replacement or repair before the ventricular decompensation. Thank you so much for your listening. And these are the references that I took this information for this presentation.
Alrighty, perfect.
Any
Thank you
questions?
for that presentation. We can go ahead and start with questions. I'll just go ahead and start off first. And so with this specific patient, does this patient have any like family history of any cardiac issues?
Uh, just hypertension
Just hypertension?
and yeah, and heart attack,
I see.
but no valvular heart disease
Okay, no worries.
like aortic regurg.
With this specific patient, what is the treatment plan moving forward, if you happen to know right now?
Okay, so you mean for the quadricuspid aortic valve,
Yeah.
or
Are they planning
uh,
on repairing it anytime soon, or are we doing like a watchful waiting?
well, the thing is, her condition was improving and worsening due to her other comorbidities. She was extremely weak. Unfortunately, the patient passed away, but it wasn't because of she had the quadricuspid aortic valve. So she's no longer with us. And although it wasn't the cause, but because of the other comorbidities. But I think if in a good case, maybe in before the fifth decade, a recommendation from cardiologist will be a replacement for the valve.
Perfect. Thank you. And if anyone else have any questions.
I had one question, Ahmed.
Yes.
What was the reasoning behind giving her naloxone when she started decompensating?
Oh, so because they thought, okay, so we will go back here. So if you can see, she was one of her past medical condition. She was in chronic use of narcotics. So they thought that she was in pain and she got in delirium because getting a lot of pain, and this is why uh, she become decreased responsiveness and alter her mental status. So they try to give her this naloxone. Uh, they were afraid of from the narcotic overuse.
Even after 6 days in the hospital?
Uh, I mean, they were giving her the narcotics during
Oh, even
this
more. Okay.
time, but she suddenly developed the altered mental status and decreased responsiveness. So they weren't sure at that time, like what's the reason behind it. So they start doing the CBC, all this and lab investigation. But before knowing all the result back, they gave her just antibiotics to cover any type of infection like UTI and furosemide because she developed also some edema and then naloxone.
Okay, thank you.
No problem. That was an excellent question.
I have a question, Ahmed. This is
Yeah,
a great. I was just curious. Do you know if there's any correlation between vegetation formation and having multiple leaflets?
multiple what?
So, like the quadricuspid. Do you
Yeah,
know?
like
Mhm.
you mean if there are more numbers than increase the risk for vegetation?
Formation? Yeah.
So according from what I read, this quadris quadricuspid or four leaflets make it easier. Uh, Usually it's asymptomatic, but with the age, they will become a site because, when with older age, the valve will become more sclerotic and it will become a site for like nidus formation and vegetation. So I don't read anything about more than four leaflets. So in order to ask about correlation, uh, but I know for sure there are different types. I read like I can show you here. I don't know if guys can see my screen. Okay, where is
Yeah,
it?
we could still see it.
No, not this one, the other one. So right now, like before, it was just the quadricuspid aortic valve, and it is like does not have any clinical significance. But right now, it has like different types, the more classification and different management. And maybe in the future, they will even bring questions about it in the U word or something like that. But I don't know. But as you can see, like there are different types. I don't know if there is one type is more prone to get vegetation, but it's a risk factor for it.
That makes sense. Thank
Yeah,
you.
thank you so much.
Any other questions?
Okay, yeah.
If not, thank you, Ahmed, for doing this presentation. Really appreciate it. And so we're just gonna go off to the second presentation. Um, 1 second.
So I'll stop sharing.
I'll go ahead and share my screen.
Okay.